We believe at Lutheran Healthcare, and I know I represent the faith community in saying that health is so much more than just the absence of disease. It has to do with the total well-being of people, body, mind, and spirit, and throughout whole communities as well. And so we are so concerned about addressing the social determinants of health and equitable access. My first question: in recent years, an alarming number of hospitals have closed throughout New York City, including a long-standing, faith-based, and I would add very mission-driven health system like St. Vincent's. Lutheran Healthcare is located in South Brooklyn. We're now facing an immediate crisis in Brooklyn, particularly with regard to the survivability, really, of many truly safety net hospitals and the much needed care that they provide to the underserved in our neighborhoods. What is your strategy in terms of effectively addressing, and I would even say stemming, that crisis, whether in Brooklyn or throughout the city?
Before you respond, we have a minute and a half, and I want to tell you that on the PowerPoint behind you are the points of the covenant tied to the question that each questioner is doing. You received a few weeks ago. So why don't we start in the opposite order with Mr. Thompson, then Mr. Liu, and then Mr. de Blasio.
Reverend Steiger, I couldn't agree with you more, particularly as you look at Brooklyn to begin with. There is a healthcare crisis in the borough of Brooklyn. When you look at Brookdale, Long Island College Hospital, which is hanging by a thread. When you look at Interfaith, Wyckoff, and so many other hospitals, the potential for a healthcare crisis in Brooklyn clearly exists. And as a matter of fact, I would say that we have reached that point right now. As you look at Queens, that had a number of hospital closings also in the last few years, it continues to lead to that healthcare crisis. Well, it's the 1 minute just popped up again. I'll be brief. I think that the one thing that the next mayor of the city of New York has to do first is not make believe that it's not his or her problem. It is to get involved right now, not say it's the problem for the state, but to take a leadership role and get involved in keeping our hospitals open first. Second, it is looking at the type of health care that we provide, not just waiting till individuals get sick and wind up in the emergency rooms. Primary health care needs to be a priority. So we start to deal with the situations that exist, dealing with health on a preliminary basis, not waiting till individuals get sick. And we can do that both through the Health and Hospital Corporation as well as the establishment of clinics that will deal with primary care. I think that is a crucial importance. Last but not least, and I know that it may come up in conversation, some of my colleagues and I have looked at Cincinnati and the school system there, where they tie healthcare in all levels at an early age. So rather than just looking at hearing and vision, they look at childhood diabetes, they look at so many other things. They also bring mental health into the schools and deal with individuals and our students, as well as to deal with the families. All of those things we need to do, but again, we can't make believe it doesn't exist. We have the mayor of the city of New York has to take a leadership role and take it now.
Last decade has seen the closures of hospital after hospital after hospital in every borough, a problem that is not his to deal with. And yet, we see tens of thousands of people having their healthcare institutions stripped away from their neighborhoods. I question exactly what has gone on. The claims of poverty, the hospitals don't have any more money, they can't afford to stay open. I openly question all of that. And I think the mayor of New York City could have looked into it much more precisely. You look at what happened to St. Vincent's. They closed it after years of supposed neglect and mismanagement, bleeding money left and right. So what happens? This hospital that probably should have gotten more resources along the way was bled dry. And in the end, they had to close down the hospital. And then guess what? Then a rich developer comes in and secures all sorts of air rights that make the property that much more valuable. Why couldn't we have done that to support the hospital from the get-go? Maybe it didn't have to close. So let's take a look at all the solutions in what is the richest city in the world. Why are we claiming poverty for everything when we are the richest city in the world, right here in New York City? And I want to work very closely in partnership with the clergy, with the clergy leaders here and everywhere throughout the city, to come up with solutions that deal with holistic health, right? I agree that diabetes is a big problem, particularly among our young people. They're having too much sugar. But is a soda ban the way to go? You know, I'm still going to be able to get my Big Gulps at 7-Eleven this summer, even as the bodegas and small business owners cannot sell them anymore. Let's try to figure out real solutions, not PR gimmicks. Thank you.
You know, in our city. I went twice to the mayor of this city, and both times he said in no uncertain terms he had no interest in intervening. Now that is just plain wrong. A mayor is there to make sure the people have health care. In every sense. To get involved. Now by the way, not only could we have saved St. Vincent's with that private development as part of the resources to do it, we could have saved St. Vincent's if the mayor lifted a finger just to bring Mount Sinai Hospital in that wanted to come in to save St. Vincent's. So it didn't have to happen. And what's happening in Brooklyn now doesn't have to happen.
That's right.
But it will take real capital from the City of New York. It will take the City of New York saying to all the stakeholders, to all the hospital systems, we must have a medical home for each and every New Yorker. When we retreat, when we take away the places that are closest to people, we are undermining their chance of being healthy. We are undermining families. And one more point about our children, and I say this as a parent as well. Our school system has been moving away from the things that keep our children healthy. Okay? It's been moving away from things like going to the gym and exercising. You can't think of what our young people need to be whole and healthy and to learn. I want to rededicate us to recreation during school, and I want to rededicate us to after-school programs that focus on the mind and the body. That's the way forward.
Does not include or expand health care coverage for undocumented persons, many of whom are currently served by those aforementioned safety nets we have referred to earlier. And in fact, beginning January 1st, 2014, in a gradual but drastic way, disproportionate share monies that go for charity care at those institutions will begin to go away in a fairly drastic and threatening way. How, from a mayoral leadership perspective, can we assure equitable access for all to the most essential of healthcare services? And I would include primary, acute, and preventive.
Thank you very much. This is a big problem facing the city of New York. Almost half of our city's population is immigrant, and a large proportion of that people who are people. They just don't have the right documents or papers, but yet they are contributing to the success, the vitality, the economy of New York City, like pretty much everybody else. This has been the New York condition for generations, if not for centuries. And it is that new blood, those fresh ideas and energy that come in generation after generation that revitalize New York City like never before. But we do have to find ways to take care of the people. Unfortunately, right now, in the federal government, under the federal laws, the hospitals are constrained. They cannot get the reimbursements that they should get just for simply taking care of people. When people are sick, it doesn't matter where they come from or the kinds of papers they have. We have to help them. And when they're sick and we don't help them, it's possible that other people get sick. So it makes sense to have a real holistic healthcare strategy here. Fortunately, President Obama is leading the way this year in terms of immigration reform that is going to be debated in the next couple of days. The President has a plan to help people earn their path towards citizenship, as well as allowing families to stay together. And I am hopeful that that immigration reform will also address some of the healthcare aspects that the current healthcare reform does not necessarily address. At the city level, we also have to beef up our health and hospitals corporations. I have conducted audits where we have seen hundreds of millions of dollars being wasted by some of these top hospitals who contract out to places like Columbia University and some of the private institutions. That money can be better used in-house to take care of more people. Thank you.
Well, I'm an optimist by nature, and I'm in a room full of optimists, I think. So I'll start with what's good as we confront this extremely complex problem, Reverend. What's good is we have a President of the United States who brought us national health care reform. Let's begin at the beginning. And New York City has a crucial role to play in making sure that as many New York City residents benefit from health care reform as possible. That's one piece of the puzzle. What's good is the President of the United States who talked about fundamental immigration reform in his State of the Union address. That was a major change in this country. Those two pieces give me hope. But you're right, on the way to fully realizing justice for immigrants so they can take full advantage of Obamacare and other services, what we have to do in the meantime? Well, I think it's a series of things. I think it's a much greater commitment to language access. There we go. To language access. There are so many services we can get to immigrants, undocumented and permanent resident and citizen, if we help improve the availability of information services in languages they speak. There's so much more I think we can do in the coordination between our Health and Hospitals Corporation and our private systems. There's so much more we can do on the preventative side, whether it's paid sick days or the many other things the government can do to help people stay healthy in the first case. It will be a while before we get it all right. But I have faith that we have many tools in New York City we haven't even begun to use that could reach the documented, reach people in need, and that in the long term, Obamacare will be a great blessing for us all.
We're talking about immigration and immigration reform. Who realizes that this country was built on immigrants, built on people like my grandparents who came here in 1917 from the Caribbean to find a better way of life. And we don't want to see a country that the people who are here now close the door behind them and say, okay, and put a not wanted sign on the door, or we're closed for business. So we are fortunate that the President is working on comprehensive immigration reform and a pathway to citizenship in this country. Second, health care. And health care, the President has worked to make sure that individuals have health care. We need to have a mayor who, again, takes the lead in an urban agenda, who gets out there with mayors from around the country, who fights for immigration, who points out the problems that we have in New York City, working with the President and others to bring about some solutions, because right now, it is a difficult situation that we face. It is understanding that our Health and Hospital Corporation needs to be there for the immigrant community. We can't say that we're not going to help, that we're not going to help take care of those who need assistance and need real health care. So it's a combination of the mayor taking the lead across the country, working with the President, and New York City doing what it always does best, standing up and saying we will not turn our backs on our immigrant communities. That's what we have to do.